Great. Well, thank you, Michelle, and thank you to the GILC members who shared their experience and why we came together as an organization. But I'd love to dive into now an opportunity to talk with Chris Mikton from the World Health Organization, and again with you, Michelle, around potential partnerships that might be budding with the World Health Organization and the Global Initiative on Loneliness and Connection. So thank you both for joining me here on this panel to talk about that. So Chris, thank you.
You're very welcome. Pleasure to be here.
Awesome. So let's just dive right in to keep the momentum going from the last panel. So Chris, just starting with you, would love to hear a little bit about yourself, the work you're doing at the World Health Organization, and how it's relating to social isolation and loneliness.
Sure. So myself, I have a background originally in anthropology and psychology. Then I got a PhD in forensic psychiatry and criminology. And in the past, I worked for the prevention of violence team at WHO, worked in academia a bit, and also worked before that at the International Committee of the Red Cross, kind of humanitarian emergency area. Currently, I'm working for the Demographic Change and Healthy Aging Unit at WHO, and this is part of the broader Department of Social Determinants of Health in WHO. And within the Demographic Change and Healthy Aging Unit, I'm responsible for elder abuse. I'm responsible more broadly for research data and innovation. I was very much involved in ageism. We produced recently a global report on ageism, which I co-wrote. And I'm also responsible for social isolation and loneliness among older people. And social connection is really at the heart of the idea of social determinants of health. And we're just starting a program of work in this area. We started a few months ago, and I can say more about it afterwards, I suppose. So that's a little bit about me and my work.
Fascinating background, Chris, and it sounds like you bring a lot to the table for this body of work. So excited to dive into that over time with you. Michelle, same for you. Give us a little background on yourself. I don't think we got to dive into that in the last panel enough. Would love to know what is your expertise and how you got involved in social isolation and loneliness.
So at the moment, I'm the inaugural chair and scientific chair of Ending Loneliness Together. My background is actually, I'm a clinical psychologist of 17 years, but also an academic researcher in loneliness, mainly in the area of mental health and in young people. But I also founded Ending Loneliness Together, which is actually a national not-for-profit organization here in Australia that addresses the emerging problems of chronic loneliness over here, and focus on people living in Australia. And the general mission is to halve chronic loneliness by 2030. And since the formalization of Ending Loneliness Together, it's actually gained over 30 organizational members across the nation, but also received support from the Federal Parliamentary Friends of Ending Loneliness, which is co-chaired by Dr. Fiona Martin and Mr. Andrew Giles.
That's amazing.
And as you know, Ending Loneliness Together also supports the GILC, and together with you, Abby, I really have got the privilege at the moment to be the inaugural co-director, and really enjoying that partnership and the work. And really, for people who don't know, the GILC really started because we just really wanted to share resources and knowledge and partner up, and then to really kind of leverage each other's skills to understand and to really lead the way with the most effective response.
Yeah, I completely agree, Michelle. And Chris, I hope you're seeing too in our emerging partnership, there's so many angles and so many sectors and so many various backgrounds and expertise that can be leveraged and brought to the table to foster greater social connection across the globe. And I think just the two of you alone are showing that from your various backgrounds and focal points. So we're so fortunate, as Michelle mentioned, to have the ability to come together in a global community to share our expertise. So really excited to continue to do that work now with you, Chris. So Chris, we would love to know, how is WHO approaching social isolation and loneliness today? What are your focal points that you think that are emerging for yourselves?
Okay, well, I guess just to say a word about our broad approach. I won't go into too much detail, but we're approaching the issue of social isolation and loneliness very similar way we approach other public health problems, using a kind of broad public health approach to this. And I think that's characterized by a focus on populations rather than individuals. It's focus on primary prevention in addition to responding to the problem, trying to prevent it before it arises, as well as responding to it once it's arisen. It's very much a multidisciplinary, as you just kind of alluded to, and a multi-sectoral approach to get all the different sectors that are concerned with this problem, bring them together. It's also systematic, evidence-based, science-based approach. We define the problem, its nature, its magnitude. We try to identify risk factors, and we develop interventions that target those risk factors, and we try to evaluate them rigorously before scaling them up, based on the socio-ecological model. Key tenet of which is that social isolation, rather than being the outcome of a single factor, is the outcome of a multiplicity of factors at the individual level, relationship level, community level, etc. And we also take a life course approach. So that's kind of a broad approach to it. Our focus at the moment is, well, first maybe I say that WHO has done very little in this area. Actually, I was surprised that WHO has done so little in this area over the years. So this is very much a new area for us. And we decided to address it, I think, for three main reasons. First and foremost, because of the serious and often underappreciated health consequences, physical health, mental health, mortality, well-being of older people in particular, because that's what we're focusing on. Second reason is that it's become, especially in a number of countries like the UK, Japan, the US as well, a very prominent public policy and public health issue. That's the second reason why we decided to take on this issue, which has been exacerbated by the COVID-19 pandemic. And the third reason is that the UN Decade of Healthy Aging, in which WHO is playing a key role, really offers a unique opportunity to address this issue of social isolation and loneliness among older people. For those who don't know, the UN Decade aims to improve the lives of older people, their families, and communities by bringing together all kinds of different stakeholders for 10 years of concerted action. More specifically, what we're hoping to do in the next years, and we've laid this out in a recent advocacy brief we published towards the end of July, is put in place, implement this three-pronged strategy. And the first prong of this strategy is really to create a global coalition to increase the political priority of this issue. And when we published this, we weren't really aware of the existence of GILC, and we've become aware of the existence of GILC, and that's why we're so eager to collaborate with you, because that's precisely what you're doing. The second prong of our strategy is to improve the research, strengthen the evidence in relation to interventions to respond to social isolation and loneliness. And the third prong of our strategy is then to scale up those interventions that are effective. And one thing we've been considering is creating some kind of global network of intervention developers, evaluators, implementers. That would be some kind of intervention accelerator. So that's our broad strategy. In the shorter term, we've been involved in a number of projects. One involves mapping all the evidence on interventions, digital interventions to reduce social isolation and loneliness. And we're now thinking of mapping non-digital intervention, face-to-face interventions to prevent social isolation and loneliness. We've been considering developing some kind of evidence platform or portal, which would bring together synthesizing and distilling all the evidence and making it available to decision makers and policymakers. And in the next few years, we hope to develop some WHO guidelines on interventions to reduce social isolation and loneliness among older people. These guidelines are usually quite authoritative documents that synthesize all the evidence and make recommendations on what to do. And they're mainly aimed at ministries of health around the world. They're often used by ministries of health to guide what they're doing. And yeah, those are our activities. And another important activity is to try to increase the political priority by collaborating with GILC to try to raise awareness of this issue. So those are our main activities and our plans for the near future.
It's certainly an ambitious agenda, and we are thrilled to hear it. And I think there's so much alignment with the thinking and the approach that GILC has been undertaking in our discussions. But Michelle, so much there. Would love to hear your thoughts on where you think across those portfolios of work are the lowest hanging fruit and biggest opportunities for GILC to engage. Where do you think the partnerships could lie there?
Look, I know, as you mentioned, we're really thrilled to actually start to commence an emerging partnership with the World Health Organization, primarily because very clearly that, there's a lot of experience with public health promotion and population-based preventative approach, which is actually something that we've been advocating for a very long time, that loneliness is actually an antecedent to poorer health down the track. But at another point of intervention, as Chris mentioned, we can also target loneliness to actually, hasten recovery, for example, definitely in the mental health space. And for me, I see GILC as kind of bringing the leading authority organizations from different countries with different expertise into play and in feeding back into the work that or the objectives or the shared goals of the World Health Organization and GILC in terms of what we can do to gather the latest evidence, what is actually being done right now in practice, and what those I guess the gaps between the science and the practice and industry practice are, and also how our policies are at the moment in terms of things that will guide us to actually address loneliness and social isolation. So I feel like it's we can harness that network in order to synergize with the work. In terms of some of the things that I think would be very helpful is really to kind of get a shared understanding of the problem. Loneliness especially is rife with misconceptions and confused with social isolation. And while they are related, they can also be independent. And there's a lot of research now that shows that loneliness has detrimental health effects independent of social isolation, but actually together they synergize and they're bad partners in crime, and actually increases mortality and morbidity of problems. So we do have to work on both, but also understanding that the pathways to poorer health outcomes might be different. And for us to tackle both and understand the pathways to chronic loneliness and social isolation might be a little bit different. Increasing our understanding, our shared understanding of what those constructs are. And the other thing, just on a side note, and perhaps Chris might like to add, is this increasing global awareness. I think, with the interest of the World Health Organization, I think that it would accelerate this level of awareness that we have, I guess, especially within the negative effects of loneliness. Most people are largely unaware of its ill effects despite the evidence. And there's also a stigma around this issue. And as the last panel talked about, the stigma and how that could be as well, that there are different cultural lens around stigma and how people see loneliness. The fact that we are not raising awareness and we're not talking about it, those things maintain loneliness. And I think just starting this conversation and the global awareness and setting up basic guidelines, all those things are just the little steps that we can take, low-hanging fruit, to actually get the shared understanding and actually start to make these kind of evidence-based recommendations or guidelines around these issues.
Absolutely agree, Michelle. And I think from my perspective, as the other co-chair of GILC, I think there's a real opportunity, and Chris touched on this in his remarks as well. I think there's a real opportunity for us to take a little bit of a step back from our day-to-day work for all of us who are working in social isolation and loneliness, and really start to assess a comprehensive approach for addressing this at national, global, local, state, all levels of interaction and impact, and really start to make an assessment of where we have gaps, where there are opportunities, and for that sort of strategy and best practice sharing in a more coordinated and systemic approach. I think doing that together, I think, could have a tremendous impact and guide national efforts across the globe. So we're so excited to do that with you, Chris. Chris, would love to hear from you on where you think the best opportunities for partnership. I think you already alluded and mentioned, but the best opportunities for partnership with GILC are.
Yeah, well, first of all, I want to say about just a few words about the importance of partnerships for WHO. WHO really would do very little without entering into partnerships and collaborating with other organizations. I mean, just for example, at the moment in WHO, I'm the only person at headquarters dealing with this topic. We have some projects with other partners, but this isn't unusual. Often we have a small number of people working on an issue, and we manage to advance the issue through partnerships and collaborations with all kinds of different entities. We have, for example, collaborating centers that help us with research around the world. I was working in violence prevention before. We used to run something called the Violence Prevention Alliance, lots of different organizations in that. We also run something called the United Nations Road Safety Collaboration, which is another partnership. So partnerships are really key to what we're doing. And we see GILC as the key partner in this area in the future. I see really a coincidence of interest. I just outlined what our strategy is, and I went to look at your mission statement and your goals, and they're not exactly identical, but they overlap to a very large extent. So I think, just this coincidence of interest and coincidence of goals means that you are kind of a natural partner for us to collaborate with. And what we aim to do, I kind of outlined it in the strategy. And I think what you were saying before about stepping back and trying to identify gaps and also identify the various actors in this field and try to coordinate their activities in some kind of coherent way with a medium and long-term strategy is critically important. So not everybody is going off doing different things or doing the same things and duplicating efforts, etc. I think this is really important. And also to have a kind of coherent approach we're all adopting, some kind of framework we're all committed to in addressing social isolation and loneliness. And I guess also sharing some kind of underlying philosophy that it should be science-based and evidence-based. So those are, I think, some of the things we have in common and some of the goals I think we're both trying to achieve.
Absolutely, couldn't agree more. Michelle, any thoughts from you on why it's important for us to be partnering with the WHO? What is that going to do for us?
I think that, partnering with WHO will allow us to have a larger array of expertise, and the fact that they have this immense experience around population-based work, that's really crucial, especially for preventing loneliness and social isolation, and also the authority and capacity to influence globally. And I think Chris mentioned this before, being able to influence government and policymakers across different nations. And I'm also very mindful that, GILC at the moment, made up of very kind of developed countries and nations, but, we should also be thinking about the impact of our work on low and middle income countries. And I think that, if we can actually design flexible frameworks, global frameworks that can be adaptive to different countries, I think that would be very much worthwhile. And that's definitely something that the World Health Organization is probably more equipped or have lots of experience with, but it's something that is often in the back of our mind.
Yeah, absolutely. I completely agree. I just have one more question for both of you as we round out the bottom of our panel here. And it's really just taking us another step back and thinking of sort of the end state, you know, as we partner together and as we get our work underway. If you could just share with us, and we alluded to this and talked about on the last panel a bit, but what should the global response be? But I'm going to take it a little step further and say, at the end of our partnerships, after we've already been rolling, what do you think the end outcome should be? What are we driving toward? What does that ideal state look like for us? I would love to just get your sort of inspirational thoughts on that. I'll start with you, Chris.
I think the endpoint we should be striving towards is really very simple. I think it's kind of obvious, is a significant reduction in social isolation and loneliness. To say an elimination would be great, but it's probably a little utopian, right? But a really significant reduction in social isolation and loneliness, and probably even more importantly, a reduction in all the consequences caused by social isolation and loneliness. So that's the end point. How we get there, should I outline, I think, a possible strategy? I think there are two key components to this, and these two components are strongly interdependent. One is better develop and disseminate the evidence. That's one thing, especially the evidence for intervention, strategies, policies to prevent and respond to social isolation. And this involves the generation of data and research. This involves the synthesis of this data and research in reviews, in platforms, in guidelines, in policy briefs, all kinds of different products that are accessible to, intelligible to policymakers and decision makers. And this also involves creating the demand for this kind of evidence-based information on the part of policymakers. So there's also this kind of job to be done to persuade policymakers, some of whom don't need persuading, but others do, that, you know, you have to implement evidence interventions and policies. So that's one of the components, building up this evidence architecture. The other component is advocacy and increasing the global priority of social isolation and loneliness. As Michelle said, not everyone's aware of this. In fact, I think, you know, outside the circles we move in, most people have no idea. You know, most people, this doesn't even cross their minds. So, you know, making sure more people know about this issue, more people know about the consequences of this issue. So really increasing the attention paid to this, especially by political leaders, by policymakers, by decision makers. And then not just raising their awareness, but also generating the political will to address the issue. The political will, the political support, and then, just as importantly, making sure that they provide the adequate resources, financial resources, technical resources, human, institutional resources, and create the coordinating mechanisms and the governance mechanisms to make all this happen. And I see this evidence architecture on one hand and this creation of global priority as being interdependent. Without effective interventions, you can have this issue the highest priority with lots of resources, you're not going to reduce social isolation. And without increasing the global priority, you can have the best interventions, but they won't be scaled up. So you need both of these. So that's kind of the broad strategy I see as being most relevant to this problem. With a view, as I said, to ultimately reducing social isolation and loneliness and its consequences.
I love it, Chris. Michelle, any reactions?
I can't beat that answer. It is perfect. But I will emphasize a few points that really jump out at me. It's really just based on my experience. Our mission at Ending Loneliness Together is to halve the prevalence of loneliness within Australia, and we cannot do this by ourselves. Even just within Australia, we need our member organizations to assist. We need government to listen. We need, people in the corporate sector and the business sector. And similarly, within the global approach, we all need to be working together to actually achieve that mission. And this is why this collaboration is really providing a strong foundation for us to achieve that. But really, one of the things that has kind of jumped out at me over working on this issue for a few years is that often people do want very simple solutions and would then apply it across large communities and simplify everything because it is easy for them to do that, and it doesn't cause any complexity for them. But actually loneliness and social isolation can be quite a complex problem. So one of the, I guess, the challenges that we have ahead is to convince policymakers to think more in line with where the evidence is suggesting, and actually implementing more effective approaches, because sometimes decisions to fund things could be quite political, and whether it looks good or whether it's easy to fund. And loneliness and social isolations are really a consequence of multiple things. And yes, we may not have a one-size-fits-all, but we would need to test several different kinds of solutions that could fit most people within a vulnerable community. So that's really a challenge. And so really being able to synthesize everything and gather the evidence and learn from what works in the UK and what has worked in the US and what has worked in Japan, and bringing all that to the table really has great benefits, because we're learning from different approaches and learning about what works and what doesn't work, and not just within interventions, but policies that have already been implemented. So I see challenges ahead, but I'm also really inspired by the collaboration and feel hopeful that we can all work together to actually harness and leverage off existing knowledge and experience and things to do and things not to do. That's really incredibly valuable.
Well, from what I just heard you both say, I think what we're saying is we really need to define and coordinate strategic initiatives and catalyze commitments to action across various levels of actors. And that's exactly what the Action Forum is here, and why we invited you to come speak. We're in complete alignment, and so thrilled to be able to work with both of you and to catalyze our own body of work together. So thank you very much for joining us for this event and for this panel, and we're looking forward to taking next steps. So thanks again, guys. Thanks for joining.
Thank you.